And about 2.5 months later, she came in, radiant. And she sat down, she said, I never in my life knew I could feel this good. Because her whooping cough was suppressed by the antibiotic. It kept trying to express every year annually through bronchial issues, once or twice a year. And what did she go back on antibiotics? And so it was constant suppression. And once she didn't suppress and we gave her the right remedy to do the healing that should have taken optimally in place when she was 6 years old, she's a different person.
Hi, and welcome to The Balancing Point. I'm Dr. John Nieters, and I'm here to make traditional Chinese medicine, functional medicine, and integrative health simple, practical, and fun, so you can restore balance, boost vitality, and enjoy a healthier life every single day. Hello, welcome to another edition of The Balancing Point. This is Dr. John, and I'm here with a guest that I'm very excited about having on. You know, it's always wonderful for me to meet with people that have a lot of experience and or a lot of new ideas of how to integrate medicine. And in today's episode, we get both. So we get Dr. Joanna Maytree, who's been doing this for, I think, 35 years, been in healthcare, and yeah. And so she specializes in hormonal health, nutrition, women's health. What was stood out to me is that Dr. Joanna has a doctorate in traditional Chinese medicine and also in classical homeopathy. And I had been the first episode that really exposed me to the idea of doing traditional Chinese medicine was actually a homeopathy retreat. The local homeopathist was being brought up on charges of practicing medicine. And so there was a big retreat for him at a retreat center. So I went to that. And in talking with everybody there, it's like, wow, okay, I want to do Chinese medicine. Took me a while to get there, but I finally did. And so what I love about Dr. Joanna's practice is she uses so many different tools, right? She's not a carpenter with just a hammer. She has the whole toolkit. She includes nutrition, genetics, fertility, again, hormonal assessment and care. That's just to name a few things. And Dr. Joanna, obviously, when you see what she's been doing, is a seeker. She's a learner. She's one of those people that will be a lifetime learner, right?
Yep.
And so I truly, truly admire that. And I'm very happy to have Dr. Joanna's intelligence and commitment here with us today. So Dr. Joanna, welcome.
Thank you. It is really a pleasure to be here. It's an honor. I'm very touched. Thank you.
Gosh, yeah, I need to come up and see you in Minnesota.
Absolutely. Absolutely.
Yeah. Well,
You're
again, one of the things I love about your practice is it's so diverse, from TCM to homeopathy, which in some ways are on the same side of the scale, but in some ways they're on opposite sides, right?
Right.
Chinese medicine, more like conventional Western medicine. If you have heat, you apply cold. But in homeopathy, if you have heat, you might give something that that could create heat. So can you tell us about some of that?
Okay. It would create heat in what's called approving.
Yeah. Okay.
So if we take a particular plant substance, okay, let's just say aconite, which is considered a poison, but it's a wonderful cardiac remedy. It's fantastic. And it's particularly good for people who've had a lot of shock in their lives. So yes, let's just say it can be heat. I'm just going with that. If you give it to patients that have no issues at all, are in relatively good health, and they take this remedy, they might tell you they start feeling warmer or they have a type of inflammation. And so that's how we learn that's exactly what that remedy in a diluted form, in a higher frequency, will treat. It will treat. So whatever it causes in optimal healthy patients is what you can use for patients that are sick in a higher dilution.
So is the body then responding to that substance to, I don't know, almost get information? How would you explain that?
It's interesting. I just went through this on a recent workshop last weekend, and we were talking about antibiotics, and we were talking about antibiotics why people can have continuing infections. You can have UTI multiple times. It could be 5 years apart. It could be every 6 months. It's, either way, it's chronic, whether it's a slow chronic or a fast chronic. So what happens is that the antibiotics it's a material substance, and it clears the material bacteria, but it doesn't clear the energetic imprint. Okay, that's the beauty of homeopathy. So the right remedy can not only clear the physical, but also the energetic. And once you clear the energetic, you no longer have that imprint that keeps showing up. That's where and I'm not saying you should not be on antibiotics at certain times in your life. It's essential. I would never say no to
Right.
that. But when you have a chronic condition, it's not working, or a chronic sinusitis. It's really reducing the heat, the inflammation, the bacterial overload temporarily, but the energetics. And then I have to go in and clean out the antibiotic because that has an energetic imprint also. So then we find remedy that works with A, the bacteria, and B, the imprint from the anesthetic.
That's
the antibiotic. And then when you do that, it's a game changer.
Well, that's a great explanation. And again, I know almost nothing about homeopathy, but when my son was 6 or 7, I guess, he kept having some recurring issues around hives, right? Now, we got rid of the hives with TCM, but they'd come back. So we took him to a classically trained homeopathist in our area, and she cleaned him up completely.
It's beautiful.
Yeah.
It's really magic. It's not magic if you don't understand the dynamic of it, but it's very magical. And can I tell you the story about this patient that I had?
Oh, please.
She came to me in her 60s with a diagnosis of breast cancer. And she said, I do not want to go on chemo. I said, okay, well, I can't by law tell you that I can, clear cancer, but let's get your immune system up. That's how I phrased it. And I took her case, and a constitutional remedy is a remedy that covers physical, mental, emotional, and sometimes spiritual. All of that within a patient. You find one remedy that does all of it. And that takes time. It takes me almost 2 hours on an initial case taking. And I pretty much identified what remedy I thought would help her, and I put her on it, and she felt great for 6 months. She felt really great. And one day she called me, and she had a horrendous cough. And I said, have you ever had this before? And she said, I have this every year. Every spring, every summer. I have a terrible bronchitis. And then I asked the big question, when did this start? She said, it started when I was 6 years old and I had whooping cough. And I said, did you go on antibiotics? And she said, yes. And I said, okay, now you're going to get better. It turned out the remedy I gave her was also a remedy for whooping cough.
Oh, that's wild.
So I wasn't going to change anything because that's a big rookie mistake. We tend to shift around and try different remedies. I said, nope, I'm going to get you through this. I talked to her every morning, every night for 2 months. I said, I need you in bed. I need you really prone and just relaxing and not running around. She said, well, it's perfect timing because I'm a teacher and it's now summer and I don't have to teach. So she stayed in bed. I spoke to her every morning, every night. She was slowly getting better, less intensity, less frequency, less duration of the cough. And I said to her, when you are done with this, you are going to feel better than you ever felt in your whole life. And she said, really? And I said, just wait and see. And about 2.5 months later, she came in radiant. And she sat down. She said, I never in my life knew I could feel this good. And what was happening was because her whooping cough was suppressed by the antibiotic, it kept trying to express every year annually through bronchial issues, once or twice a year. And what did she do? Go back on antibiotics. And so it was constant suppression. And once she didn't suppress and we gave her the right remedy to do the healing that should have taken optimally in place when she was 6 years old, she's a different person. And I ran into her. We kept her on remedy for another year. She's complete remission of the cancer. And here's the concept that people don't realize that when we suppress something, it just goes somewhere else. So she never, ever identified that her cancer could have been related to that immune suppression or that bacterial suppression all the way back then.
Wow, that's a great case. One of the things that stands out to me about that is your amazing commitment, that you were in contact with her twice a day. That's an amazing. I can't quite imagine my medical doctor doing that with me.
No, here's the thing. Here's somebody who's trying to clear almost 60 years of a pattern. And you wonder if you're ever going to get through it. And so that's why I show up for them. And when my patients get sick, especially since COVID, there's not too many of them that they've been on a protocol, so they don't get it. So most of them have done very well. But the few that have it, they're like, when is it going to end? So I have them call me every morning and tune in and say, okay, this is better, this is better, this is better. Then we wait. We're moving in the right trajectory. If it's not better, noticeably not better, then I say, okay, next we find something better for you. So
do you also, I know you do acupuncture, homeopathy. Do you also do Chinese herbs with patients?
Absolutely. Absolutely. Especially now, since COVID, there's so much cardiovascular issue with the whole spike of protein inflammatory clotting and AFib. AFib's not normal to see on commercials constantly. Take this, take that for AFib. Anyway, I use Chinese herbs and I strengthen the kidney and the heart because, as you know, they're relational. They have, if one is down, it affects the other. And it makes a difference. And I have a patient now who's 93 years old, and she has kidney failure, lung failure, COPD lung failure, and cardiovascular, her heart failure. And I put her on the Chinese herbs and one homeopathic to strengthen her heart and her kidneys and lungs. And she called me up. She said, I'm going to make it to 100. She's still performing as an artist. She's an actress.
That's so beautiful. That's just beautiful.
So yes, you need to, in that toolbox, you need to know what is it. You can't just say, oh, you have this, take that. That's Western medicine.
Right.
Do this, do that, whatever. But it doesn't always work for people. That's the problem. So you have to really know your case, assess your case, and align the right remedies or herbs, like in Chinese medicine, or protocols for them.
Thank you. That's a great answer. So where did you do your homeopathy training?
I had a school that came into the U.S. and the Hormonal. And I did that series of workshops with them. They were really good. Really good. In fact, I think if I remember correctly, the head of the homeopathic school, and he came over here to teach us. He was the homeopath to Queen Elizabeth.
The royal family is huge on homeopathy.
I know. Isn't it great?
Oh, yeah. I know an acupuncturist that they used to come to also.
Yep.
So they knew what was going on.
Yeah.
I mean, you see how long most of those people live. I mean, it's amazing.
You're right. You're absolutely right. And I will say that my patients that have been with me every month for 35 years.
Wow.
Every month they do a check-in, and they're leaving people in the dust.
Mm-hmm.
They're surviving their families and their friends, and they're aging beautifully.
Well, I interviewed Dr. Pat McShane a little while back, and, talking about postmenopausal issues. And we both agreed, although she vehemently, that older women are really often overlooked and given short shrift. Now, I know from my experience that older men sometimes are too, but I kind of insist on getting what I'm there for. But often we both said that that's a huge problem. It's like, oh, well, of course, you're 70. Of course, you've got these problems.
I agree. And I was interviewed by Pat. She was lovely.
Oh,
And
she is, yeah.
one of the things we talked about, and I do tell my patients, is that women, when we grew up, if women died at 65, passed away, nobody blinked. It was kind of normal.
Right.
And now women are living into their 90s and 100s. And so they're half their life is without the right hormones, without good bioidentical care. And you have to really study a case and understand their history and their lineage and their familial history. You know, if there's breast cancer all the way through, no, we don't do estrogen, but there are other ways around that. And so what I have found is that women are aging without the support that they need, and they're getting into menopause earlier.
Yeah.
I mean, there are women who are 29 going into menopause.
Yeah.
And the reason, from my perception, the reason is that we have women that are having babies, going back to work, running a household, in a marriage, or maybe not.
Mm-hmm.
And it's a huge amount of stress. Huge.
Yeah.
And they're having to micromanage everything, and they're wearing out a lot faster.
Yeah,
and
I see.
Depletion.
Gotcha. I treat a fair amount, not as much now as I was. I'm now treating more long COVID type things, but I was treating a lot of ME/CFS or chronic fatigue, which has a huge overlap.
Yeah.
And I would see woman with 3 children running their household and working as an attorney. And you can only do that so long. You know, it's just, it's not sustainable. And I have, like 2-parent families who will have 2 or 3 kids, and they spend their entire weekend driving them to sporting events.
Class.
Now, I played sports all through high school. My parents never drove me anywhere, not once. I don't think my mom ever came to a game. My dad came to a few of my baseball games, but my mom didn't. Nobody expected her to. It was, just take the stress off, be a mother. And it's so hard now. It's so many additional things just heaped on top of it. So, and then we've got all the other influences that, are a problem.
Yeah. COVID changed everything. And when COVID broke out and we really got the news about it, I knew something was wrong because I was treating 2 children that weren't responding to remedies that I knew worked. And I turned to my assistant. It just came out of my mouth. It's not something that was thought. And I said, this is a global Holocaust. This is much more than just COVID. We're going to have big fall apart thing happening here over the next number of years. And sure enough, it was a global event, and it really affected people who still don't know some of their current symptoms are related to that.
Right.
So it's education.
So I had the tremendous good fortune in my doctoral program, and it was not my doing. I was just in the right place at the right time.
Perfect.
To have studied with the 2 best-known stroke doctors in all of China. Zhao Xunfa, who created the scalp system, and Shi Juimin, who ran the largest stroke hospital in the world. They saw 10,000 patients a day there. They built a railroad station to take them, the patients out there. So anyway, I studied with them. I almost never saw a stroke patient. It was very rare. Nobody really thought of, going to Chinese medicine for stroke.
Right.
But then the pandemic hit, and I have so many stroke patients that I'm currently seeing after vaccination.
Yep.
And it was just, we're flooded with them, right? So
I agree
made a huge difference.
I have one patient who had a spinal stroke, which
Oh my gosh.
Yeah. And she was getting a lot better on remedy, but she was really hooked into the allopathic system. And her doctor told her she had some kind of muscle issue in her legs, which was diminishing, but she wasn't patient. So she ended up taking a botulinum injection.
Mm-hmm.
And the case went to hell in a handbasket, because that undid the work that we had done and that the trajectory we were moving on. But people want a quick fix. And sometimes it just takes time to rebuild the damage, and the whole neural pathways and myelin sheath and all of it needs repair.
And as you certainly know, it generally took people a long time to get to that state of ill health. Now,
Correct.
sometimes it's an auto accident or something, but it goes back to childhood in many cases.
Well, you
And
saw the
so,
cancer case, right? With
yeah,
whooping cough. It goes way back.
yeah. And so then to expect to heal that in a day is really not very
It's
appropriate.
magical thinking.
Yes, exactly. Well, thank you. And I saw that in your bio, it mentioned genetics.
Mhm.
What do you do with genetics?
Well, usually I got into genetics when I was 58 and really burned out, and I just couldn't make a comeback, essentially. I kept working, but I was really suffering. And I read an article on, MTFR and MTRR and all these genetics, and I went, that's me. That's me. That's me. So I immediately had my genetics tested, and I had a wonderful practitioner. He's a cardiovascular specialist, but he also got into genetics for his patients, and he taught me well. And I ended up doing it for my patients. And so once we get the raw genetic data, then we can put it into a program and I can see, gee, what's your dopamine levels? What's your serotonin levels? And most of my genetics is not optimal.
Mm-hmm.
I'm very sensitive to Western medicines. I don't do well with them. That was on there too. Detoxification is slow. Made sense with my past history. And then I really got into it, and it helped a lot of people, a lot. It's like being reborn, because there are things you can do to take where those genes are slowed down, or, only half of that gene is functional. Then you can take certain supplements for it, and it changes everything. It's great. But
Yeah,
you got
that's brilliant.
yeah.
And it's so much more available now and so much less expensive.
Yes.
It's it's very affordable to most people now to
You
do
can do a
that.
test for $350.
Right.
And then, we pop it into a program. And I used to do it all by, looking up each one. It was just painful.
Well, sometimes that's how you have to start, though. So I've written 2 lab books, one on the Chem 14 and one on CBC. But I remember when I started reading labs, I would be sitting here with my computer and a textbook every time going, aha, that's it, right? And of course, after a while, you get so that you can read those in a matter of minutes.
Right.
But it was agonizing for the first few. And I tell students that, and they'll say, well, where did you learn this? I said, well, I did some education, but at the beginning, I was self-taught. And, after a few tests, you can look at it and go, of course, right? And so that was good that you had to go through that probably.
Well, I think, you're a seeker too, and it doesn't stop,
Never.
So,
I mean, Western medicine, there's something new every day. I mean, I don't know how many podcasts I get now and blogs, but there's something new. But Chinese medicine is so deep. It's no matter how deep you go, there are deeper levels. And you read about some of these brilliant physicians in the past and what they were doing. It's like, that's amazing, right? So,
do you know Kiko Matsumoto?
not personally, I've done classes with her.
I met Kiko 35 years ago when she first came to this country, and I think her work is amazing. And I've been doing her style of acupuncture since then, because you get results before that patient even gets off the table.
Yeah. Kiko's not only brilliant, I saw her just a couple years ago, and she had as much energy as she did 35 years ago.
I know.
So there's something right there.
Yeah.
And I also noticed, I went to your website, and I noticed that you created a product line for your patients' well-being. Can you tell us about that?
Well, it started about maybe 5 years before COVID hit. I created a product called Respiratory Protect. I had a lot of infants and babies that were coming in with, croup, and I certainly gave a remedy, but I created this product called Respiratory Protect that prevents getting colds and flus. You just put a little bit at the nose and sometimes on the lip and certainly on the throat, or you can use it at the first sign of getting sick, or you can use it on the chest for bronchitis. And it was incredibly amazing. And then when COVID broke out, I had all my patients go on it. And that was a big game changer for them. Rarely did I see one of my people with COVID.
That's wonderful. Amazing. We've been, I,
Sorry. Go ahead.
no, we'll see so many patients that clearly are still having long-term effects from COVID, but it's
Right.
hard for them. They just can't quite grok it. They don't really put it together. So we've started doing more spike protein lab tests, and they'll come in, 25,000 times what it should be, and then trying to explain to them, yeah, the virus is one thing, but you got this spike protein and it is still, essentially clogging you up.
And it takes
Right.
2 years to break it down. But I did a workshop just on this in, I think, February
Mm-hmm.
about, what to take to break it down. And it's different for every person, again, given their history, but it's doable.
Yeah,
And, so what? It takes a couple years. What's it big deal? Because the bottom line is you're going to get there anyway. So why not be getting there in better shape? Right?
exactly. And who knows what would happen otherwise during that 2 years
Yeah.
with those spike proteins. Yeah, we're kind of on the same page here. Although
Yeah.
I do admire your homeopathics a lot. I'm a little envious.
Oh.
So that's why you created the product line then.
Well, and I did what's called antiseptic assist. It's like a natural Neosporin, but it doesn't have any petroleum in it at all. It's clean. It's the highest essential oils that I can get. And I have a vendor that travels the world and won't buy it unless it's tested and up to the top tier. It's more expensive, but it works. It's beautiful. It's like a living biological conglomeration.
Mm-hmm.
And so I have the burn balm. I had a colleague call me and say, I have an almost third degree burn, and she spilled boiling water onto her abdomen. And I said, I'm sending this to you now. She'd been for 2 weeks on Silvadene and it wasn't working. And she was in a lot of pain. I had her put it on. She sent me a picture. Less than 48 hours later, it looked almost completely healed.
Wow, that's amazing.
So I think these things should be in everyone's medicine chest. You just leave it in the fridge,
Yeah.
because it's a living substance. It's alive. So in the sense that it's so synergistically and biologically connected.
So it's pretty shelf stable then if you refrigerate it.
If you refrigerate it, it's good for about 3 years.
Okay, cool.
And
That's
so,
great.
and then in winter, people take out their respiratory protect. If they have a burn, I have one practitioner who actually ran an iron over her fingertips. And she put on the burn balm and she said within 2 hours, all the blistering was gone and the white from the burn was gone. So it does work. I'm not interested in making one product that works and creating multiple products to create a line that don't work. I
Right.
want each one to stand on its own merit. So antiseptic assist, burn balm, trauma balm is a big one. So whenever there's an injury, if people put that on with some infrared, it works beautifully. Even a fracture, once they are taken care of, and I can do homeopathy for reducing pain and knitting bones faster.
Mhm.
But if they use the trauma balm on it, falls, sprains, everybody trips eventually somewhere. So
Right.
this stuff works really, really well. Tendonitis, all these things. So I would say that respiratory protect and trauma balm are the two number ones.
That's awesome.
Yeah.
If someone wanted to purchase those, how would they go about it?
So on the website, it will say Core Star Healing Arts
Okay.
or Nova Botanica.
Okay.
And so corestarhealingarts.com, Nova Botanica is the product line, .net. It'll take you right to the site.
Okay.
And on that site, you click on Nova Botanica and it'll just show you. I have a skincare line also for sun damage and radiation damage. And then I have one for just aging. And
Well, you mentioned several things that I'm going to buy for myself. I grew up in Napa where it's very hot and sunny, and I would play baseball for 6-8 hours a day without a hat on. And so my skin, I have to go in, or I have been going in once or twice a year to get things burned off, but I would love to get some of your remedy.
yeah, and we can talk after. I'll give you my protocol, how to prevent, precancerous lesions. I did a
Love it.
workshop on that just 2 months ago. I was a dermatology nurse at one point.
Oh, really?
Yeah.
Okay. That's
And so
great.
I'm like, when I look at people, I look at their skin,
Yeah.
you know,
Well, I
so
look at a lot of things, but dermatology is definitely not my specialty, right?
it wasn't mine
So,
until I worked for one of the top practices in Beverly Hills, actually. And
oh,
these
really?
were good guys. They weren't flashy, trying to sell you repair work all the time. They were real humanitarians about it. And I enjoyed working with them and I learned a lot. I
Oh, I'll
really,
bet.
yeah.
Yeah.
So
And so I know you do hormonal support. What do you see that actually gets missed a lot when women and men, I guess, too, are looking at hormonal support? What do you see that doesn't get handled?
3 things. First is blood work's not accurate because I can't remember her name. There was a practitioner almost 20 years ago, an MD in Stanford, and she rounded up a bunch of women and started drawing blood. And what she found was that we pulse our hormones every 10 minutes. So when you get a blood draw, if you're low, did you just pulse
Mhm.
and you're low? That's not good. Or you're about to pulse and you're low. There's no way of knowing.
Mhm.
So I personally do a 24-hour urine collection, and
Okay.
it's unbelievable with Meridian Valley Labs. It's excellent.
Well, they've
And
been around for a while.
I've been with them for 30 years.
Wow.
And so I work with their doctors and we have good conversations. And if I look at a test going, this is really unusual, then I'll get on the phone and go tear it apart from top to bottom. They're excellent. So that's one thing, the type of testing. Sometimes people really like saliva test. I don't.
Mhm.
You can't beat the 24-hour one. That's it for me. The other thing is that the number one resistance I see in the medical system is that almost always there's low thyroid, there's hypothyroidism, and people aren't connecting the dots. And the
Right.
doctors will say, nope, your results are normal.
Yeah.
Your T3, T4. Well, did you run a reverse one? Nope. You got to
Yeah.
push for that. And then what I have found is that they want to do Synthroid. It's only synthetic T4.
Right.
And with this hormonal test, I can see what T3 and T4 look like through the urine collection. And it's usually pretty low. And we know that the thyroid has a relationship with estrogen.
Right.
So when one's tanking, the other one's likely affected. So what happens is doctors don't want to prescribe T3, T4 porcine, a natural one. They don't want to do it because they're locked into a habit, a system. Nope, just do this. And there's a lot of big pharmas trying to get the more natural thyroids off the market, and that's
Right.
always a big deal. But every patient who's gone on T3 and T4
Yeah.
porcine, it's a new game.
Well,
Absolutely.
as you know, one of most of the large HMOs in our area, if they do a thyroid test, they do a TSH, and then they will do a T4 if that comes out of range. They never do T3. And as you know, so many people don't convert T4 to T3 properly.
Right.
So, it's that you could take
Not in the
Synthroid
blood.
all day and it's not going to help.
Yeah,
Right.
it's not in their system circulating, it's in
Yeah.
the tissue instead. So
Yeah.
it's not moving out. Right.
A few years ago, so my doctorate's in gynecological endocrinology. So for years, I did tons and tons of fertility work. I mean, it was just wall to wall females in here for fertility work. And in all of the cases that came here, and most of them were called unexplained infertility because they checked everything that they check. And they'd come in and I'd say, it's stress. You got a very stressful job. And I went through all the stressors, which of course they were used to that. So they didn't see it as stress.
Exactly.
And so we would test reverse T3 and I'd test sex hormone binding globulin, which both go up with stress. And they were through the roof.
Yeah.
And as soon as we could get them de-stressed with whatever methodology we used,
Right.
they'd get pregnant. Right.
Yeah.
And they think it was some magical event. It's just, no, you let your body relax.
Yeah. We're living in a world where everything is escalating and time is moving faster and people are way more stressed. They're just trying to survive, not thrive, and
Yeah.
And it's been building for a long time. It's been really building.
Have you met or are you familiar with Dr. Daryl Turner?
No.
I interviewed him, I think last week. Boy, I teach thyroid to doctoral programs, and I actually thought I knew something. And then I was disabused of that notion by Dr. Turner, who has had like 800 centers all over the world doing essentially very, very sophisticated testing of the reflexes. And he says, really? If the reflexes are slow, you got to suspect hypothyroid, right? And so anyway, they have a very sophisticated way of actually measuring that. But one of the figures he threw out, and I haven't verified this, and I don't know if I could, is that only 18% of thyroid testing is accurate, right? Really is consistent.
I am 100% with that. Absolutely. Because what's happening is the test is quantitative and not qualitative. So what happens is when if you see the symptoms, they're always chilly, or their eyebrows are thinned out, or their hair is falling out, or they're just tired all the time. I don't care if the test reads normal on the blood work. That's your system that's doing that, but they're not normal. And so I have them do basal body temperature.
Right.
And an iodine skin test. I have them do those things. And when they come back and I say to do it 3 mornings in a row and give me your temperature. And if it's, below 697 if it's below that, then
I think Rhoda Barnes said, I don't remember exactly, but he, I think, is the one who started that. And
there's the Bible. There's the Bible, and I ask my patients to buy it so that they can understand what's going on. And it turns out asthma and allergies and hives, all of this can be related to thyroid stuff.
Yeah. And of course, it's getting worse for a lot of reasons. But one of them is, back before the turn of the century, a lot of people didn't live into their 20s if they had severe hypothyroid. They'd get infections. They couldn't fight infections. And now, it's a blessing that we keep those people alive. Right. But of course, the gene pool then changes. And so we've got a huge, huge number of people that are, really functionally hypothyroid. So.
What I have found, aside from the lifestyle that we have at this point in time and where it's been building up, where people are overworking and exhausted, but aside from that, what I have found genetically and hormonally is that when you come from a lineage of great stress and persecution or trying to survive, completely changes the genetics. It harms the genetics. Now, is it fixable? Yes, but you have to be aware of it. That's why I always ask about the familial history, because almost all those people are low thyroid, aside from that, as well as really poor genetics.
Yeah, good point.
It's not a death sentence. It's just, this is what we need to focus on and rebuild.
Yeah, absolutely. That's a beautiful sentiment. I know you treat everything. And so what's kind of the root cause behind joint pain, right? We see so much joint pain.
I can't believe you missed my workshop on that. My God, I'm so amazed that you knew that. The number one cause of joint pain, and I'm not talking about, people who run for 20, 30 years and then they have no cartilage in their knees. Right. I'm not talking about that. And then they get osteoporosis, which we have a good remedy for that also. But not osteoporosis. They get
osteoarthritis.
Thank you. Yes. So I did this workshop on joint pain and inflammation. And, there's lots of causes for inflammation, but the number one that showed up in Genova testing, their lab, was oxalates. And so the high oxalate foods, raspberries, beets, there's a whole cache of foods that are high. Almonds. And so everybody was getting off milk and drinking almond milk. And then they were having really weird joint pain, joint pains in the elbow or joint pain in the shoulder or joint pain in the hip or the knee. And they're like, where is this coming from? I don't even have osteoarthritis in my family. So they couldn't figure it out. And then I did this workshop and everybody kind of stayed away from those foods and increased their calcium intake. There's a particular product that I now use for osteoporosis, but it's got some calcium in it that's absorbed well because of the MK4 in it. And they did great. It was gone. All of the joint pain was gone.
Wow.
So that's the first thing that I look for is an oxalate overload because spinach is really high in oxalate.
And you see, I mean, there's been a shift in the type of kidney stones, right?
Yes.
Oxalic acid is, calcium oxalate has just surged because people are doing spinach and kale smoothies in the morning.
That's right. Exactly. I agree with you 100%. And when I was in veterinary medicine a long time ago, can you see what's in here?
I can see something, but I'm not sure. It looks like a dishwasher pod to me.
No, these are stones.
Oh my God.
These are kidney stones. And bladder stones.
Okay.
So I can't believe I say this. We had a surgery and this poor sweet dog, I think he was a healer. He had really bad stones and he kept having it. So we just went in and cleaned it all out. And that is in my little box.
So I had 2 stones that were that size in my kidneys. Yeah, they were 2.54 and 2.56 centimeters.
Painful.
Yeah, it was crazy. And I developed them. I went about 20 years being vegan, vegetarian, and ate so much oxalate. It was crazy.
There you go.
Right?
And you think you're doing the right thing.
Yeah, absolutely.
Yeah.
Yeah. So I had a few lithotripsies, and I think I'm stone free.
And you're probably not eating spinach now.
Oh my God, that stuff doesn't even come near my lips.
Yeah, and people are so into beet juice now because of, nitric oxide.
Yeah.
But the reality is it may not be, you can take it if you take calcium foods with it. And if you think about most cultures, there's usually, you have a baked potato, it has sour cream, calcium in it.
Right.
Okay. You have borscht, there's sour cream in that. There's cheese that goes with a lot of other foods that are high oxalate. So I think culturally, humankind did know that it needed to be balanced like that.
Yeah.
Interesting.
Yeah. No, it's fascinating. So you also mentioned sinusitis, and that's one of the things that I have found. Chronic sinusitis, acute's pretty easily treatable, but chronic can be hard. What's your trick there?
Well, again, I look and see when it started and how many antibiotics they've had, and I clean that up first. And then I have a sinus remedy.
Okay.
So that seems to be really helpful. And I have found something very interesting. Don't ask me how this happened. I'm somewhat intuitive. So I one day was thinking, wow, some of these patients really have trouble sleeping and you do everything, passion flower and melatonin and they're not sleeping well. And I thought, thymus, I wonder if thymus has a relationship to sleep. So I looked it up, big relationship, big. And I started putting my patients on sheep thymus. And every one of those patients that did very, very, very well and slept better and were so grateful from the sheep thymus had sinusitis chronically.
Wow.
Yeah, it was a really interesting connection. Well, that's what I do when somebody tells me they have trouble sleeping and they have a past history of sinusitis. I bolster their thymus.
Well, there are many things I'm enjoying about our talk, but that's a hot tip that I'm going to take away.
Okay.
That's awesome. And, on some level, it makes perfect sense. We know the thymus is so involved with the immune system.
Correct.
But I had not ever thought about that. So thank you.
No.
And I'm seeing, well, there's a lot of literature now. A few years, just before the pandemic, I did a talk on dementia prevention. And we pulled up studies from Mexico City that were showing almost 50% of young adults, like 20 to 30 years old, that died from an accident, were already showing pretty severe Alzheimer's. And they did 200 dog autopsies, or I guess they call them necropsies. They all had Alzheimer's. And they proved that it was from those 2.5 particulates. Now, we had several big fires out here
Yep.
where the air quality was over 300. It was horrible.
Yep.
And I think we're going to get a huge surge in dementia. Do you have any thoughts about that?
Well, we've had a huge surge in memory loss. That's a good way to start on that path.
Mm-hmm.
I do have patients that lost their homes in Pacific Palisades from the fire. One of my patients who didn't live that close tested off the chart for uranium. And so I sent a blitz out to all my patients. If you are living in the LA area or nearby, you need to get tested for heavy metals. So that is one big event that definitely has an effect on brain function. You know, we know heavy metals is not optimal for the brain or anywhere in the body.
Right.
So that's the first thing that I always look for is a heavy metal test.
Yeah. I find that's one of the biggies. And so we have a test called an oligoscan, which is looking at intracellular metals, much like a spectroscope.
Wow.
And it's very rare to find people that have, I'm going to say, that don't have excessive levels of mercury, and aluminum is off the charts. But the mercury, as you know, the old saying, mad as a hatter, because the hatters used mercury. And we know that the 49ers, a lot of them lost their minds from smelting with the mercury. And unfortunately, the highest level we've seen was in me. So I'm working diligently to get some mercury out because I had a mouthful of fillings growing up. And my father and I used to go fishing out here in the San Francisco Bay and catch these 40-pound striped bass that were full of mercury. So I got probably the highest dosages of mercury into my system that I've ever seen. So
I
we're working to get.
might be on the same place as you. I went through it and I got tested, and my mercury, my doctor said I've never seen it this high. Never. It was because I ate sushi every lunch.
Right.
Every day.
Yeah.
For
There's
years.
so many sources, so many sources. But aluminum, we're seeing very high levels. It's everywhere.
About it. Didn't our parents barbecue with aluminum and, foil?
When I was growing up, my mom, and when I was an adult, used to always say how little Johnny didn't want to play with his toys. He just wanted to play with the pots and pans. Yeah. Well, the pots and pans had dents in them. So they had to be aluminum. They weren't stainless steel, right? Yeah. And that's what we ate off all the time. And if you go to a restaurant, my son's a chef. They use aluminum because it's the easiest thing to cook with.
It's fast and it heats up even faster. And it's cheaper, a whole lot cheaper.
It's a whole lot cheaper, exactly. So we see some really scary gadolinium, right? Doctors say, oh, it's out of your system in a couple days. Well, it's out of your urine or your blood maybe, but it's still in your cells. Because when we test, the only patients we find with high gadolinium have had gadolinium as a contrast. They're the only ones. So it does not leave their body. No. Otherwise, we wouldn't find it. Right?
I agree with you. I think there are a lot of things that are not intentionally meant to be harmful, but they are. Yeah. And this is the next workshop I'm doing next month, which is bottom line, it's not just biotoxins, it's all toxins in our food, in our water, in our air, in our land. Most people don't know when there's a fire that it brings up uranium right out of the surface of the ground, and we're inhaling it, and not good. Cadmium.
Well, we find we can pretty much predict where people live by some of the things that we see, the arsenic levels, for example. So I have a question. I know you treat Lyme disease, and you do it certainly holistically. Absolutely. How do you combine those your treatments for that?
Well, I have a recent case that's doing beautifully well. She had 2 tick bites under her collarbone. She didn't know it was tick bites. The doctor said, no, it's probably a spider. Don't worry about it. And then a number of issues began to crop up over the next 2 years. And when I met her, she had one knee that looked like elephantiasis. and I gave her, and a shoulder that was really not easy to move around, not very mobile. And so I gave her an acupuncture, did great on her back, did great on her shoulder, didn't do anything on the knee, which has never happened before with the technique that I do. And I said, you need to get this tested. And she did. She got a synovial test. And sure enough, after 2 years of going to doctors for various issues, the test showed positive in her synovial fluid for Lyme's.
Wow.
I said, okay, now we know what you have, so now we can do it. So I put her on an immune product that specifically targets, it raises your antibodies, so you're no longer reactive to the Lyme's. I put her on that, and I gave her a remedy specifically for Lyme's. And I did one other thing. I gave her, there's an herbal, it's not Chinese medicine, but it's an herbal powder specifically for Lyme's. And I did that. She's clean. I mean, she is just moving and grooving and getting things done that I can't even keep up with her. She's phenomenal. Her energy was fantastic, and she's completely cleared. Once a year, I tell her 3 times a year, just retake everything, because it's that spirochete. It's that.
Absolutely.
And it digs in, and you need to make sure it's not remaining.
I've seen photomicrographs of brain tissue where you can see the spirochete corkscrewed into the myelin sheath. It's very scary stuff.
It is scary. And of course, in Minnesota, it's one of the top Lyme's places. And, I have a beautiful forest behind me, but I have to wear, a hat and cover up because they just drop out of trees. And, I'll be sitting there watching TV going, what's that? And then I'll pull a tick off and I'm like, no. So I run and I go to the Lyme remedy. So.
Have you heard or read any of Lyda Mattman's work, Mattman? Well, I actually popped $140 for her book a few years ago, which I usually am not willing to do that. But she was so brilliant. And the name of her book is Stealth Pathogens, Cell Wall Deficient Forms. And so this is an idea that many people had come up with, not many, a few people had come up with before her, that bacteria are pleomorphic. They can change shape and form. And she proved that the beta-lactam antibiotics that destroy the cell wall, she said a certain percentage, it's very small, of those bacteria will continue to live without a cell wall. And they can then at any time come back, develop into a regular cell-walled bacteria. Well, they laughed at everybody else, but she was too big to laugh at. She was just a brilliant, brilliant biochemist, and everybody knew that. But she identified so many tests and things that could be done. In my mind, she really blew the lid off of Lyme in many ways. She developed new immunofluorescence testing. And she said that there were actually 26 vectors that she had identified. Now, the reason the ticks were so much more severe is, well, a lot of reasons. I won't go into all of them, but one of them is when they inject their saliva, it actually causes the Lyme to spread faster and differently. But she identified people that had spider bites that it might take 10 years before you got symptoms, but there were many other vectors. But anyway, brilliant woman. I probably understood 80% of it. But
I know. When I read some of this stuff, I'm like, oh my God, just give me the Cliff Notes, please.
Right? Exactly. So anyway, I keep her book very close just for those things.
Yeah,
so
I think that's great.
We've talked a lot about physical medicine of one type or another, but I know that you're very involved with spiritual side of healing. Can you talk about that for a minute?
The longer that I do this work, the more I realize you cannot separate one from the other. And if you can really get to the root of what is subconscious, or just even having patients do, people don't want to do meditations because their mind is busy the whole time. They're like,
Right.
I can't do it. I can't do it. I can't do it. And what I've learned is just take 2 weeks and sit there and watch your mind doing its thing. Don't try and, squish it down or chase it away, or just let it do its thing. And sure enough, after 2 weeks, it starts to diminish. And then you
Yeah.
can get into that really peaceful place, which, we're all human in the sense that sometimes you can get there all the time. Sometimes you can't, things happen, but just keep trying. And it makes a difference because when you can get to that stillness, that's when information comes through. The real information, not the busy brain information, not the cognitive overload information.
Yeah.
And so oftentimes I'll take patients into their heart field and then information will come up to them then. And I accompany them through that process so they're not alone in it or afraid of what they might find out. But it's a game changer for a lot of those patients. And I don't do it for all of them. The ones that are open to it are receptive, not in resistance.
Mm-hmm.
Because right now we're in a period of evolution and we need to evolve. We cannot remain the way we are. We're living in hard times. And so, a lot of systems are collapsing. Our government system and our post office system and you name it, our educational system, all the systems that are big systems are really kind of falling apart here. And so we're seeing the worst of people coming out because we're meant to deal with it and then make a shift.
And then on the microcosm, you get family systems falling apart, right?
Yep.
It's people torn away, moving away from their families. I read a book. So my son was homeschooled up until high school. And then he went to high school because there weren't any girls in his homeschool group, really. But at the very beginning of that, I had a book called Hold On to Your Children. And I think the first page, he pointed out that until World War II, basically, education was vertical. You had your aunts and your uncles and your grandmother and grandpa, and everybody was watching you and working with you and, giving you their wisdom. Well, he said in World War II, when the families fell apart, which that my mom was yanked away from her 13 or 12 siblings, then it became horizontal and the kids started teaching each other and they didn't know what they were teaching, right? And so it really started to then fall apart in many ways. And I see it still that way.
War is a big factor in falling apart.
Yeah.
In our environment. And so was the, when the whole industrial era came on.
Industrial revolution.
Yeah, the Industrial Revolution changed a lot of things.
Yeah.
A lot. So the connections that we used to have that were supportive, we don't have anymore. And so I would say that 90% of my caseload will say that they don't have the familial support that they wish they had. In fact, most of them tried to get away from their family because it was so dysfunctional.
Yeah. And I found with recent politics, you have families just torn apart, literally, by political arguments. And that to me is incredibly sad. Disagree, that's fine. But, no, they've locked each other out of their lives. So,
yeah, this is not, what I'm going to say is not a religious statement at all, because I'm not aligned with, any particular religion at all. But it's about a Christ consciousness. It's about, caring and support and understanding and compassion. And we're missing that. Every time somebody does something really nice to me, I'm absolutely flabbergasted. It's pretty wonderful.
Mm-hmm.
But it can be something very small that makes you feel very good about it. I was in a camera store and I had an old camera and it wasn't worth anything, that I could sell, and I wasn't going to use it again. And this woman next to me said to her agent or tech across the counter, said, I'm looking for this kind of camera. I know it's old fashioned. Where would I get one? I really want to do this art project. And I turned to her and I said, give me your hand. And she put her hand in it. And I said, put the camera in it. And I said, it's yours. It's those kind of things that shine, not because I wanted to shine. It made me feel so good to see her whole face lit up. She was like, are you sure? Can I pay you? Nope, this is your gift. So we need more of that in the world, and we don't get it. right
Yeah,
now.
I have to remind myself. I read a book a few years ago called Giftology. Now,
Oh,
yeah, the gifting had a little bit more of a business connotation, but it reminded me that, when you give someone a gift kind of out of nowhere, it changes their life for some period of time.
yep,
It's such a wonderful thing, and it's really so easy to do. You
I
know,
know.
I'm reminded in speaking with you about the phrase, and I think this was William Osler, the heart guy, but he said, the good physician treats the disease, the great physician treats the patient who has the disease. And
Well,
that's you. So,
thank
yeah.
you.
Yeah, you bet. So, last question, the hardest one,
Uh-oh.
kind of looking at Chinese medicine, acupuncture, herbs, and the Tao.
Hmm.
How do they align with the forces of nature?
It's everything. Every single thing in nature is a pattern, and it's communicating to us. It's information. And most of us don't even pay attention to it
Yeah.
at all. I need to live near nature because it's a food for me. Information comes through. And we are part of that nature. We are, but we abuse nature.
Mhm.
We do not treat our planet well at all. We don't care.
Right.
I think there are people who do care now, but it's not enough in numbers to make a change. And we need to do it. Our greenhouse emissions are terrible. So I think, the Tao is really, so to speak, the Bible of everything that is living on this planet.
Yay. Yay. I love it.
Yeah.
I've seen, I get a couple of blogs where people are all excited about this new thing called regenerative farming.
Oh, yeah.
And I just want to remind them that that's farming. That's how it was done for
Yeah.
thousands and thousands of years,
Yeah. Yeah. No.
rotating crops, etc.
Yeah.
Yeah. And
It's not
so did they,
new. It was,
yeah.
but at least they're excited. That's a good
Yeah,
thing.
exactly. I love
Right.
it. I remember reading a report from Congress in the 1930s, and they said there was over 70% of all nutrients were already depleted in our soil. Well, now it's down to about zero. You just throw a little nitrogen out there and you get a plant with no vitamins or minerals. So,
I recently purchased this home and I have a terrace and I'm landscaping the terrace and we have fireflies here and it's absolutely
oh,
magical. Yes, it's magical. And, the first year I was here, I didn't really see that many, but now I've put in this whole, garden for, living beings, butterflies and, it's just really a pollinator garden. And so they are all over.
hmm,
They are like now flooding that area. And it's so beautiful because you're giving back to nature. I'm restoring some nature and they love it. They're coming out. And I had a fox come into the garden the other day. And then the same day I had a beautiful doe. I mean, absolutely gorgeous young female deer.
wow.
She
Yeah.
came in and then I had two white herons come in. Actually, one heron and two egrets, white egrets. And then on the mama, there's about four geese, mommy and daddy, four pair, and they were promenading them around onto my property.
That is wild. That's
Yes.
wild.
When people love nature, they know it, and then you're in an alignment.
Yeah.
It gives you back.
Deer are amazing. I was a few years ago up at a retreat center, and it was early in the morning, and I was out on this small lawn area doing a Tai Chi set. And I suddenly became aware that a whole group of people were watching me. And I thought, that's interesting. And then I turned my head just a hair, and there was a doe with her nose about this far from my nose. They feel it. They get that energy.
Well, and in shamanic work, the deer is all about the heart and brotherhood, all of it. That's what they represent.
That's fascinating. I had to stop teaching Tai Chi in the park. I used to go like at 6 in the morning, but the neighborhood dogs would find us and they would come lay between my legs. they feel it. They feel all of that. And so we had to move indoors, unfortunately.
Well, that's what I loved about veterinary medicine, because when your heart is really open to them, those animals are very, and I did exotic animal work. So
Uh-huh.
I did anesthesia for Siegfried and Roy cats and the
Oh,
big
wow.
cats and stuff like that. So,
Yeah.
but I'm telling you, when you make that connection, it is bliss, really bliss,
I have
right?
an important, oh God, yeah, they, as much as they feel our energy, they speak back to us,
Yes,
it's,
exactly.
yeah, it's well, my associate, Catherine, comes over in the morning and we go to the gym. She brings her dog. We have 4 females. He's a little male and they get along great. And then we'll take off. But I had noticed I was not doing well a few years ago, and I realized I had to get my testosterone up and my human growth hormone. And so I found some natural ways to do that, and it was pretty effective. I doubled my testosterone levels, and all of a sudden, her dog wanted nothing but to sit on my lap. That was it. I was now the alpha. And when he stopped doing that, I got alarmed, went and checked my testosterone again, and it had dropped. Yeah.
Isn't that amazing?
Oh, it's wild. It took me a while to figure out why I had become the center of attention. Yeah.
You
So,
were the big daddy.
yeah, exactly. So, Joanna, this has been delightful. Absolutely delightful for me. Do you do any telehealth?
All the time. That's almost all that I do now.
Oh, boy. Okay. Well, uh, I'm going to have some people to contact you for sure. I love the way you work.
Well, thank you. If they email me info@CoreStarHealingArts.com.
Hmm. Is that CoreStar?
Yeah.
Okay.
You
And we'll
know,
put,
I only had one patient ever ask me why my practice was named CoreStar Healing.
okay.
CoreStar is you. It's your illumined being inside a human body. It's your eternal being inside your body. We just only think about the body, but the core star is the connection to pure source.
I love it. I love it. So
That's
we
why.
will, of course, post that, your information so people can get a hold of you.
Well, and if they go to the website, CoreStarHealingArts.com, and they go there, they'll see the workshops. They're very informative. I mean, everybody's been really happy with it. I'm just trying to build a base at this
Uh-huh.
point, because this is new for me this year. But people are not well, and they don't even know they're not well, and they would like to do maybe some holistic options. Then it's $36.
Oh, wow.
Yeah.
Okay.
I tried to make it affordable for people who can't afford, functional medicine care.
Would
So
you feel okay about us putting that information in our weekly newsletter
I
about
would
upcoming things?
thrilled. I would be
Okay,
thrilled. Yeah. The next
great.
one is on toxins, and the one after that is we're going through what we're going through right now.
Okay.
And then, which is a little bit more on the spiritual side, but I would repeat any one of these workshops because they're already set up. They're ready to go on skincare, on spike protein,
Mhm.
flus, colds, and COVID. I've just done so many of them already, and they're just, everybody's been happy with it. And that's what I want to do. I want to give this information out into the world, because we have choice. We have options. People just aren't familiar with it. They're not
Right.
recognizing it or being exposed to it. So kudos to you for doing this podcast. Not
Well,
this
thank you.
me, but in general, doing podcasts.
Yeah, I've come to love them, right?
Yeah.
Once I figured out how to make it effortless, right? I'd been done a few, but it was a huge amount of effort. And now it's just totally effortless. And I love doing them. I do them 1 or 2 a
That's
week. It's
great.
great.
Well,
Yeah.
this is why the workshops were, oh my God, the slides, and I want it to be, really informative and visual so that people can really grasp it. And I was like, oh my God, this is so exhausting. And then I realized, I was making it more integrative,
Uh-huh.
where people can really express how they feel. And then it became super fun.
Hmm.
Like, how do you feel about this? Do you understand this? Are you with me? Okay. but then somebody would say, well, what about blah, 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 blah. And then we would get into a wonderful conversation, and the group started to getting tighter. They started like, I remember you from last time. It was really beautiful. It was community.
Yeah, just building community. So alivening.
Yeah,
right?
it
And
is.
healing.
And that's when you know you're really helping people. And that's the whole point. We're here.
Well, thank you. I thank you again for talking with me and teaching me some things and really making some things available to our audience.
Well, it's my pleasure. And I think we should probably connect
Yeah,
outside.
sounds like a good idea.
Okay. And share some stuff. Okay.
Right, exactly. So
Right.
I'm going to say goodbye, and please check out Dr. Joanna Maytree's information and keep joining us here on The Balancing Point. Thank you.
Thank you.
Thank you for joining me on The Balancing Point. If you enjoyed today's episode, please follow the show, share it with a friend, and leave a review. Feeling out of balance? Most approaches just manage symptoms. Here, we get to the root. So real healing, real clarity, and balance can begin. Visit AlamedaAcupuncture.com. That's AlamedaAcupuncture.com to learn more, explore our supplements, or book a call. We'd love to hear from you.